Saurabh, welcome to the show. Let's start with what is day-to-day into.
Thank you. Thank you very much for giving us this opportunity. So, DayToDay is a acute care management company. We can manage the patients outside the hospital before and after any complex surgeries. We provide a smart, evidence based program to reduce post surgery readmissions and complications, saving money for the hospitals and improving patients' lives. We work with the hospitals and doctors to support the patient's care journey, and we work with the patient to make sure that he recovers well after the surgery has happened and not confused with the stack of papers that he has.
In the COVID times, healthcare has come to the fore. Everybody's talking about the healthcare. Has this opened up in a big way an opportunity in the segment in the sector that you are?
Well, we've been operating into this space for last 2 years, and even before COVID, even before the lockdown happened. And what we realized was that this is a universal problem across the world, where the patients are confused, doctors don't have time, and the family members need more support because they're not aware of what really a patient needs to go through. And hence, as a result of which, irrespective of the situation we are in the current scenario, the market was always open for us. They all welcome us with open hands about the kind of offerings that we have, and we have had some tremendous success in past 2 years, while we have served some 6,000 odd patients in this journey.
So tell us about the product itself or the service itself. How does it work? What are the interface between a healthcare professional, a patient, as in end user, or the family members?
So, typically when a patient has been identified with a surgery, we onboard that particular patient into our system. There is a complete holistic program that runs for that patient, which helps them to understand what will happen to them before the surgery, how do they really need to prepare for it, and what all steps they need to take after the surgery has happened. Similarly, doctors don't have to keep on repeating the same set of activities before as well as after the surgery, so that the surgery can happen at the time that has been scheduled for that particular patient, as well as after the surgery, where he knows what is exactly happening with the patient in that journey. Now, this is for the doctors. If you take any patient, that intervention is maybe the first or maybe at best the second intervention for him in his lifetime. All he has done is heard from his family members or friends that something of this kind happens and these are steps he needs to take. But you really need somebody to handhold that patient, not only from a clinical perspective, but also from other parameters where you look after his mental well-being, where you look after his nutrition, where you look after his other parameters of what he needs to do on a daily, day-to-day basis. And that's what we do as an organization. There are situations and there are families who are not living with the patients. They are far away, they don't have time, work from distant locations, and they want to take care of their parents, their family members, and anyone who has undergone that type of a surgery. And in this process, we enable them as well so that they know how the patient has been performing on a day-to-day basis so that he recovers faster, better, and in the more holistic way than they have recovered in the past.
So does this happen over an app that you have? Because the way I understand is the first time a patient comes into contact with your solution is only when he reaches to a hospital. But is there a way he can he can be in touch with the solution or access his information post a surgery or a post a treatment?
Yes, there is a digital platform which works between the hospitals as well as the patients and caregivers. But then it is much more beyond the technology platform, where we have trained clinicians and certified doctors who work with the patients as well as with the hospitals to make sure if there are any escalations, we take those escalations back to the treating doctor and back to the hospitals so that they know what really had happened with the patients in the past and they can advise necessary suggestions for the patients to take care, or maybe come back to the hospital in case that is needed. So it's more like, assuming that a Queen of England has undergone a surgery and he or she needs some kind of a support system where different types of specialities of medical support is available in the Buckingham Palace. And in case something really happens, then the treating doctor is really informed about it and he takes care of that particular patient. We focus on democratizing that type of a model, and that's what we have been able to do successfully in India for last 2 years.
So data protection and data privacy is one of the big challenges or a big question on top of mind of everybody. How are you addressing that?
We started with MIT funding us as an organization. That's where we all started. We made sure that our data protection and our policies are very clearly defined. So we are a HIPAA compliant and FHIR compliant organization. Our policies are on GDPR systems, and we make sure, irrespective of the location where we execute our programs, these policies are really taken care of in utmost strict possible way, so that the data of the patients or any of the medical records don't move out unless and until it is defined as part of the policy.
So of the two, medical practitioner, hospital slash a patient, who's more welcoming of the solution that you have?
Both of them, interestingly. Doctors don't have time. Hospitals are burdened with so many activities they have to do. They are worried about the readmissions that are happening in the hospitals. And hence, something of this kind is like a boon for them. Talking about the patients are really worried because once they have interacted with the doctor as part of the surgery intervention, they don't have somebody to talk to. Their questions are as simple as whether they can eat, whether they can bath, how is their wound getting healed up. All of that is taken care of through our AI enabled platform with specialists on the ground who work with the patients on a day-to-day basis to make sure they are healthy and they are connected with the doctors in the hospitals.
So, given that there are multiple hospitals, many of them corporate hospitals, small, big, how are you addressing the challenge of data interoperability between these hospitals?
So we work on the principle of open APIs, and we have necessary ecosystem built up where we can very easily connect with the hospitals. And the hospitals also have some form of EHR or EMR type of systems where, whenever they want to take up the data elements from our systems, we can easily connect it with our APIs, and all of that gets transferred based on the policies and data protection laws that have been set up for that land.
Are the hospitals willing to share their data, as in allow you to access their data or access their systems?
Well, at the end of the day, we both help and support the patients. That's the end goal. And all the elements, all the stakeholders in this ecosystem work together to make sure that it is achieved for the patient as well as for the betterment of this entire process of intervention that we do for the patients as well as the hospitals.
So finally, what does it mean for you as a young startup to be able to participating in NASDAQ 2020?
Well, we are very excited to meet like-minded people. We are very excited to meet a lot of healthcare leaders, and we are very excited to talk about the solutions to a lot of other people who may willingly or unwillingly end up in the hospitals for various types of surgeries, various types of interventions, and we are happy to work with them in their care journeys to make sure that they are healthy and they are safe.
When you hear about My Startup TV, which is a channel for startups and MSMEs, providing them or showcasing their journey, what is your first thought?
I think this is a great initiative that My Startup TV has done and worked with NASCOM to support all different startups and all different organizations to share their views, share their viewpoints, and take it to the masses. And I would say all the best to My Startup TV to support this initiative.
Thank you very much. Thanks for joining.
Thank you very much. Thank you for your time.